After cancer treatment, scans might show that tumors are gone. But sometimes, a tiny number of cancer cells remain hidden in the body. These microscopic survivors are called minimal residual disease, or MRD, and they may determine whether cancer returns. Minimal residual disease refers to extremely small numbers of cancer cells that remain after treatment. These cells are often too small to detect with standard CT scans, MRI scans, or PET imaging. Yet they may survive quietly in the body and potentially grow again months or even years later. MRD has become one of the most powerful tools in modern cancer medicine. Why? Because detecting these tiny cancer cell populations can help doctors predict relapse risk, monitor how well treatment worked, guide future therapy decisions, and personalize cancer care. In many cancers, MRD status is one of the strongest predictors of long-term outcomes. MRD test results are usually reported in two ways. MRD negative means no cancer cells were detected at the sensitivity level of the test. This usually indicates a strong response to treatment. MRD positive means tiny numbers of cancer cells are still detectable, which may increase the risk that cancer could return. Detecting MRD requires extremely sensitive laboratory technologies. One method is flow cytometry, which analyzes blood or bone marrow cells and identifies cancer cells based on their unique protein markers. This method can detect roughly one cancer cell among 10,000 to 100,000 normal cells. Another powerful technique is polymerase chain reaction, or PCR. PCR detects specific genetic mutations associated with cancer cells. Because PCR amplifies DNA signals, it can detect one cancer cell among hundreds of thousands, or even a million normal cells. One of the newest MRD detection tools is next-generation sequencing, often called NGS. This technology analyzes millions of DNA fragments at once and can detect extremely rare cancer DNA sequences in the blood. It is becoming increasingly important in leukemia, lymphoma, and multiple myeloma. For many solid tumors, scientists can detect MRD using circulating tumor DNA, also known as ctDNA. As cancer cells die, they release tiny fragments of DNA into the bloodstream. Advanced sequencing tests can identify these fragments and reveal whether microscopic cancer may still remain. MRD testing is widely used in blood cancers, including leukemia, lymphoma, and multiple myeloma. But researchers are now expanding MRD detection into solid tumors such as colon cancer, lung cancer, and breast cancer. In some studies, MRD detection through circulating tumor DNA can identify relapse months before scans show a tumor. Minimal residual disease testing is transforming oncology. Doctors can now detect relapse earlier, personalize treatment plans, monitor therapy effectiveness, and design new targeted therapies aimed at eliminating residual cancer cells. Scientists are developing even more sensitive technologies capable of detecting one cancer cell among millions of normal cells. Future MRD tests may combine genetic sequencing with artificial intelligence to predict cancer recurrence with even greater accuracy. Minimal residual disease represents one of the most important advances in modern cancer monitoring. By detecting microscopic cancer cells early, MRD testing may help doctors prevent relapse and guide more precise treatment strategies. To learn more about cancer science and treatment research, visit helping4cancer.com.